today. So this is the Adson Distinguished Lecture. We have 4 named distinguished lectureships throughout the year. The Adson Lecture today features Dr. Wellons, and it's featured a lot of very prominent names within neurosurgery in the past. So I'll invite Dr. Emiliano Sanchez to come up and introduce Dr. Wellons.
Morning, everyone. It is truly an honor to present today's speaker for this year's Adson Distinguished Lecture. We can bring it up again. I'm going to start talking. Dr. J. Wellons is a renowned figure in the field of neurosurgery whose journey is marked by exceptional achievements and stellar academic background. Dr. Wellons holds the Carl Turner Chair of Pediatric Neurosurgery and is Chief of the Division of Pediatric Neurosurgery at Vanderbilt, as well as the Monroe Carell Jr. Children's Hospital at Vanderbilt. He's also a professor in the Department of Neurological Surgery, Pediatrics, Plastic Surgery, and Radiology, and Radiological Sciences, and he's also the Vice Chair of the Department of Neurosurgery.
This is the last slide.
He can change.
This is the last.
I have a speech here. So he founded the Surgical Outcome Center for Kids in 2015 and served as a medical director until 2022. He also served as Vanderbilt's Section of Surgical Sciences Vice Chair of Clinical Research in 2018 and 2022, and Department of Neurological Surgery Program Director for the Neurological Residency Training Program from 2014 to 2018. Dr. Wellons received a BA in English from the University of Mississippi in 1991, his medical degree for the University of Mississippi Medical School in 1995, and completed his residency in neurological surgery at Duke in 2001. This was followed by a fellowship in pediatric neurosurgery at the University of Alabama. After his fellowship was complete in 2002, he remained in faculty at UAB for a total of 10 years, obtaining an MS-PH during that time. He then came to Vanderbilt in September of 2012. Throughout his career, Dr. Wellons has been the recipient of numerous prestigious honors and awards, including the winner of the Robert McClary Master Teacher Award in 2022 and the Excellence in Patient Experience Award in 2021 and 2022. Dr. Wellons' scholarly contributions have made a significant impact in the realm of neurosurgery. Here are some of Dr. Wellons' most recent research articles, and while his past areas of interest include surgery for brain tumors, blood vessel malformation, craniosynostosis, his current focus is on the surgical management of Chiari malformations, congenital neurosurgery, and lesions of the brachial plexus. Dr. Wellons has an outstanding academic background as evidenced by an H index of 50 in Google Scholar and 40 in Scopus with more than 6,000 citations. And not only Dr. Wellons is recognized for his back academic productivity and excellent patient care, Dr. Wellons is also the author of the recently published book, All That Moves Us, A Pediatric Neurosurgeon, His Young Patients and Their Stories of Grace and Resilience, which debuted in June of 2022. Once again, it is an honor to have Dr. Wellons with us this morning. On behalf of everyone present, I extend our gratitude for sharing your time with us. Thanks, sir.
And just before you start, sir, I would like to do a quick update to acknowledge how many people we have around the globe joining us this morning. So this morning we have close to 40 attendees in person and 75 virtual participants from 14 different countries, including Argentina, Colombia, Libya, Dominican Republic, Austria, India, Panama, Japan, Mexico, Italy, UK, Indonesia, Brazil, and multiple states in the US. Thank you.
Yes, absolutely. Thank you. I appreciate it. That was wonderful. You guys may want to take this back after I get my call. Well, thank you all so much. I'm so honored to be here. This is the reason why we have visiting professorships, is to reach out among departments and among people. And I think that there may be some things that you all pick up, but honest to goodness, I think I've picked up the most so far. What a wonderful department that I'm witnessing here, and what an important mission. I have two terrific partners, Chris Bonfield and Michael Dewan. Not to say that Rob Naftel is not a terrific partner, but just in terms of the two of them, plus our fantastic nurse practitioner Haley Vance, have a passion for international neurosurgery, and travel to Tanzania and Peru and other countries to perform pediatric neurosurgery. And when I look out and see the international reach and the global focus of this program, it gives me a very strong sense of joy, honestly, in my heart, to see what this department looks like and what your overall mission is. And it's not just in the clinical realm, which is extremely important, but the number of clinical trials and the number of presentations, the work that you're all doing to kind of, be the Johnny Appleseed, carry neurosurgery out into the world and improve care. It's just, it's terrific to see. So I commend all of you for this shared mission and these shared values. So, as was said, I have had the opportunity to have a wonderful career. I'm very grateful for it. I did my residency, as was mentioned, at Duke. Thank you for that warm introduction, by the way. I did my residency at Duke, and then from there was at UAB. Took 1 year to do a fellowship, but I lasted 10 years there. So I used to say it took me 10 years to get my fellowship certificate, and then was recruited to Vanderbilt and have been there since 2012. I have had the opportunity to be on the administrative side of things, on the clinical side of things, and also a program director for 5 years, which was also a wonderful learning experience for me. The 5 years that I spent as program director was really one of what I would like to call shared vision, where it wasn't just myself thinking that these are the things that we should do, but it was myself and the residents that were a part of the department at that time, and how many wonderful friends I made. And that McCleary Teaching Award is probably without a doubt, I don't even say probably, the biggest honor that I've had from the residents at Vanderbilt, and also the rest of the residents of the section. I then spent some time, as head of research for SOCS, the Surgical Outcomes Center of Kids. It's a group that we put together to help be a research engine for clinical outcomes research. I'd gotten an MSPH while I was at UAB, and then was asked to be the vice chair of the section of surgical sciences for clinical research, to basically form a biostatistics mechanism and research mechanisms, and to kind of wrangle the understanding of industry-funded research, and was able to do those things as well. And so, as what happens in one's career, I've begun to embrace the different part of my brain as you get older. I had the opportunity to reflect. Mine was medically induced. I was, at Mach 5, and then basically on, standstill for about 2 months after an operation. And I had the opportunity to kind of think about over the course of my life. I'd been an English major at the University of Mississippi, had been taught by creative writers like Barry Hannah and Ellen Douglas, who are really wonderful Southern writers. Barry Hannah was kind of the classic. You had to write essays to get into his class, and to be allowed in. And there were only 5 of us in his class, and he would come in and open up all the windows at the bottom level of this classroom and take out a flask and set it on the desk and take out a pack of cigarettes and pack it down and then start chain smoking. He would pop off the filter and just start smoking and talking about writing. And I just didn't realize that the effect that would have on me, 25, 30 years later. But I have begun to write more. I had an initial piece that occurred in the New York Times that was a funny piece. I was talking a little bit about it at dinner last night. And that funny piece has actually turned into what has become something incredibly important to me. So with that, I'm going to make sure I know how to advance the slides. I assume it's probably the mouse. Oh, that's the wrong, of course, that's the wrong button. Okay, yes, I have to disclose that, as you always do, these are what I call my left brain disclosures, and then this is my right brain disclosure because I am under contract with Penguin Random House. As I mentioned before, this is the division that I work with. Rob Naftel is a wonderful partner. I've known him since he was a medical student at UAB when I was on faculty. He does our epilepsy and spasticity. Rob literally as a medical student walked in to my office and said, "Oh yeah, the dean said I'm supposed to talk to you about neurosurgery." And from that, I said, I need to get this guy to be a neurosurgeon. And then when he was a resident, I need to get this guy to be a pediatric neurosurgeon. And then when he was a pediatric neurosurgeon, I said, I need to get this guy to be my fellow. To be my partner. And then now he's our fellowship director and doing a terrific job. Christopher Bonfield came to us from Pittsburgh. Very proud of him. He does our spine and craniofacial. He's a terrific surgeon. And he's the one that I mentioned that really has started the work and carried through with the work with Tanzania and with Peru. And, Chris and I were talking about how to make international neurosurgery better. And I said, you should take Reed Thompson, our chairman, on one of your jaunts. And he did, and now it's become a passion of Reed. I think Reed's gone now 6 times and has carried teams over himself, so it's wonderful. Michael Dewan, I mentioned, fellowshipped up in Toronto and now is back, and he heads up our tumor and vascular work. Haley Vance is the real boss of the division. People actually call her the boss in front of me, which I'm totally fine with, and Charles is a wonderful PA that works in our clinics with us. Our fellow this year is Nick Zaflita. We're honored to have him. He finished at Walter Reed. He's going to be a pediatric neurosurgeon within the Army, and he's doing a terrific job. And there he is with his family. So I'm here to talk about writing. I've talked enough about the left brain stuff. There are a lot of physician writers. You think about just theologically, let's just careem off into a spot where, there's a lot of prayer and supplication that goes up from the standard lunchroom of any hospital on any day of the week, oftentimes more than there is on a Sunday at most American or Southern churches. So, writing is something that is important, has been important to physicians for a long time. And Chekhov is obviously one of the very, most famous physician writers that we have, but William Carlos Williams, Farrell Sams, John Stone, Sir Arthur Conan Doyle, who wrote the Sherlock Holmes, was a physician himself. And so there have been a lot of people who have tried to explain and understand the human condition through their writing. And I love this quote from Chekhov. It's not a matter of old or new forms. A person writes without thinking about any forms. He writes because it flows freely from his soul. And that is something that really appeals to me, because when I was putting together the book, I mentioned I'd had that one piece in the Times that was funny. And then I was talking last night to the crew at dinner about how it turned out my editor at the New York Times was a guy named Peter Catapano. And Peter, unbeknownst to me, his shtick is helping new writers write more. And so he said to me, look, you've got a funny piece. Why don't you write a serious piece? You're a pediatric neurosurgeon. I know you see serious stuff. And he kind of helped me think through and what a serious piece, quote unquote, would look like. And as I began to write more and more and more, it really does kind of flow freely. These stories would begin to come up and I would need to get them out. And when I was really deep in the process of writing, and as I think through all the people in this room, who have patient care as part of their duties, we are talking to people at some of their most difficult times. I mean, we understand that sometimes the first time they meet us is maybe the worst day of their lives. And that's an honor to be able to try to kind of be their vehicle through understanding, and then through recovery, through treatment, and then through recovery. Reed Thompson, my chair, always talks about there is peace with a plan, and how important it is to sit down with somebody and say, yes, this is a brain tumor, and yes, this does need to come out, and here's what our plan is, and here's the date that it's going to happen, and here's what's going to happen afterwards, and here's the team that's going to take care of you. And that degree of compassion and that degree of empathy is incredibly important as we talk to our patients and as we move through this journey with them. I also like these two quotes. Oprah Winfrey says, everybody has a story to tell. And a friend of mine, Carolyn Randall Williams, who's a associate professor of English at Vanderbilt, says every body has a story to tell. And so what I mean by that is, everybody in this room, probably has a story to tell about somebody that they've taken care of. Just like from the patient's perspective, everybody, that oral boards case, behind those x-rays is a woman who's osteoporotic, whose head's fallen off the top of her shoulders, and who comes in looking to you for an answer. And it's thinking through the challenges of what to do biomechanically for that case, but it's also trying to understand how to sit and talk to her and explain what the risks are. So everybody has a story to tell. This is a visual depiction of my writer's journey. And what I mean by that is that this was the picture that came along with the first piece that came out in the New York Times. And basically, I will tell you that it was a story about being called as a responder on the flight. And I was headed up to Vermont. I was really sick and tired of overpacking. Anybody that's lugged my bag around today, even though I went to the Mississippi Book Festival before this, I still packed too much, but I decided I was going to pack very light. I was going to wear one suit. You go to dinner and then, wake up the next day, give the talk and fly back. So I had a very small bag with me. So I was very proud of being minimalistic, and I got called on this flight. And luckily a nurse practitioner, family medicine nurse practitioner did as well. And we introduced ourselves to each other and said, I wonder what this is going to be. And if it's going to be somebody with chest pain or somebody having a stroke or stroke symptoms or dizzy. And we went back, we were led back to the 26C, and in that seat was a middle-aged man with a grapefruit-sized wad of tissue in front of his nose that was saturated with blood, like dripping with blood onto his seat, and there was spattered blood around him. People had moved. And I will fully admit that the first thing I thought of was that I was in my only suit for the next 24 hours. But we pushed through that, and ultimately, I had a severe nosebleed, and I did the things that you learn in Boy Scouts, which is to pinch the nose, and it did not stop. It did not stop at all, no matter what we did. And we pinched for 10 minutes, and it was like a geyser of blood. And he had had a Bloody Mary early in that morning. He hadn't taken his blood pressure medicine. He had hit his nose when he was putting his briefcase in the overhead. There was a lot of factors that were contributory, but at the end of the day, he was really bleeding. And so I was trying to think through it. I said, does anybody have any Afrin? And somebody handed up an Afrin. And the nurse practitioner with me said, in a tampon. And I said, oh my gosh, that's brilliant. And so we asked the flight attendant to see if anybody had a tampon on board. And so she went and said, boom, yes, if anybody has a tampon on board, we'd like to have you ring your call bell, please. And all of a sudden, boom, 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 boom. And I watched her take that wicker basket that they have the pretzels in, and she just dumped it out on the floor of the galley, and she passed it around. And by the time she got back to us, there were small, medium, large, things with wings, things without wings. I mean, it saved the day, right? So we dabbled some Afrin on the end of the tampon and put it in an orifice it wasn't designed for, and both sides, and got it to stop. And I wrote a little bit more about how the medics, when they came to the plane, made fun of us and then realized how significant it was. But that piece came out, and that's the art that came with it. And then after that came a piece called 90 Minutes from You by Ground that I'm gonna read here in just a bit. That was the quote unquote serious piece. And then I'm going to also talk about writing not as a reason to tell stories that are meaningful, but writing as a reason to change minds. So I'm going to move on, but I'll go to those heads too. So basically writing to tell a story that's impacted my life. And what is it that you want to do, right? So as a writer, what you want to do is try to lay bare the human condition, okay? You want to try to understand, people write a lot about love and death. That's a common, and illness. Those are things that non-physicians write about in their books. But as a physician, you know, we're there at the bedside, or we're there in the OR suite, or we're there in the angio suite, or we're there as people are going to sleep. I mean, when you have surgery, and it is likely that you will, your attitude towards anesthesia will change in a phenomenal way. It really will. The first time I had surgery, I remember going to sleep and thinking, my gosh, I never realized how important that compassion and care that's coming from these faces around me is. First time you're rolled into an operating room and you're the one that doesn't have a mask on and everybody else does, and the bright lights are on the table that you're going to lay in. I mean, it's incredibly important. So the goal is to lay bare the human condition. And then also, this is extremely important to me, is to establish commonality. And so what I mean by that is that, just take some of the things I've just said just now. You all have stories to tell. You all have taken care of patients at the bedside. You all have a shared mission of global neurosurgery. Think about the woman with the cervical spine whose head has fallen off of her shoulders. You know, giving a sense of what we all have in common is very important, because I believe if we can establish commonality between one another, then we can get a sense of community. And if we can establish a sense of community and responsibility to one another, then this is when we can start to really dig into and help repair some of the rifts in our society. Now, that's not to say that a story about putting tampons in somebody's nose is going to save society, but it sure can lead to a discussion about writing that can potentially do that. And I think that's really important to understand. I think for me, it was important to reflect as the writer upon my career. And I was forced into it basically by being on bed rest and having the opportunity to catalog all the stories from my life. I talked a little bit last night about how, basically what I did was just take the different epochs of my life and write down 1 or 2 word stories from patients that I cared for, either as a medical student or as a resident, and some notes that I'd taken to try to put that into place. And then you can come back to that and you can fill out those stories with your memory. Axeman is a character from one of the stories in the book, and I remember vividly that whole experience of the title of it's called A Mississippi Nick, and it's about a guy who had gotten in a fight, and I was a fourth-year medical student, and a hatchet had gone into his neck and it just nicked his carotid artery. And I reflect back on the power of the human heart and the power of a single heartbeat, with each beat of the heart, and how high that blood would spurt every time. It was a phenomenal experience. And then I think it's supposed to enable you to remember as the reader. So maybe as you read a book or any type of book, you think about similar experiences that you yourself have had. Because again, it's about that sense of commonality that I was talking about. And then I also think in its truest and best form, I think it's to inspire. I'm very fortunate to be very close friends before my writing career, and then also to have as my writing sensei Ann Patchett, who is a wonderful fiction writer who lives in Nashville. And her books are inspiring. They're fiction, and they are inspiring. The way that she's able to write her characters and write their realizations and write their foibles and write their flaws, it really captures the human condition. And to watch us be at the Mississippi Book Festival and watch hundreds of people line up to get her to sign her book, her most recent book, and to see them walk away with such joy in their face, I think that's commonality that she establishes. And then in some way, as she thinks about her characters, they're part of her family, so she reflects. It causes those that are reading it to kind of remember the relationship to their own family in her most recent book. And then it is certainly inspiring. And you watch that over and over again. And I do certainly with colleagues and friends that are in the writing community. It's remarkable to see this. you get this, there's a term for it I'm blocking on, but this kind of sensory, like a meridian sensory response, where it's phenomenal to see people that can do this well. So what I wanted to do, and I want to make sure that I'm within my time, is read a piece called 90 Minutes from You by Ground. And what time do I go to, Dr. Kunis? Okay, all right. Okay, all right, good. All the residents just went, oh. Don't say take your time. Oh, no. Okay, 90 Minutes from You by Ground. On a blustery, rainy Saturday in my first year of practice, I went to my office after rounds, put my feet up on my desk, took a sip of lukewarm coffee, and leaned back in my chair to relax after a busy morning. Within seconds, I felt the pager clipped to my belt vibrate. I set my mug down on the desk and called the number back. An emergency room doctor from another hospital immediately picked up and identified himself. "Doc," said a clipped voice, "we've got a 9-year-old girl who was a rear passenger in a 2-car collision about 2 hours ago. She's just arrived. The scan shows a 3-centimeter subdural hematoma on the right side of the brain. We're a small show. Can you take her?" "Yes," I said immediately. "What's her exam?" "Her right pupil is blown and she's posturing on the left." The pupil typically dilates on the side of the brain with the increased pressure. In this case, the right side, as the brain is forced down and away from the blood clot. The nerve responsible for pupillary function basically goes haywire and starts to enlarge in response. The term posturing indicates a movement pattern that comes from damage being done to the part of the brain that deals with movement. Both are outward signs of high brain pressure. Put bluntly, this girl was sick, getting sicker quickly, and the window to save her was closing. "Why don't you already have her in the air?" I asked, slightly annoyed. My hospital was in Birmingham, Alabama. Theirs was in Auburn, 100 miles away. A medical helicopter could have her here in just over 30 minutes, well within the window to save her. "Weather's too bad between Auburn and Birmingham to fly in. She's 90 minutes from me by ground, at least." Clearly knowing what that meant, an hour and a half in an ambulance plus the 2 hours since her accident is a long time to have high ICP and expect to survive. "What do we do?" he asked. Even now, when I'm faced with a situation without an obvious solution, my mind goes to my father and the calmness I felt flying next to him as a child. During his more than 4 decades of service in the Air National Guard, he piloted all types of planes in all types of situations and weather. Early on, he taught me to review the flight checklist before every takeoff and landing. Once aloft, we would practice emergencies in the air. As we would gain altitude and I would be focused on keeping the plane level on the horizon or interpreting the navigation system, he would quietly feather the propellers the tiniest amount or trim the flaps, just so. Then, as we gently lost airspeed and the altimeter would slowly begin to wind down under his watchful eye, he would have me work the problem until I had it figured out. Flying and problem solving for my father went hand in hand and were as much a part of him as breathing. As the brief memory faded, I found myself staring at the worn photo of him that sat on my office desk. He is standing next to an F-4 Phantom, helmet under his arm, grinning widely at his olive drab National Guard flight suit. "Are those Black Hawk helicopters still stationed at that base near you?" I asked the emergency room doctor. "Yes, but," he trailed off. Then he was back. "Yes, those guys will fly on anything. You get the Black Hawks. I'll let our operating room know." My office overlooked the street in front of the hospital. After half an hour, I looked down to see the surface of the coffee in my mug rippling like in the scene from Jurassic Park, where the approaching T-Rex's footsteps are detected in puddles of water. Within seconds, there were rhythmic pulsations all around, then a strong thump, 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 as the air beat against my window. Outside, in the midst of the downpour, trash cans tumbled down the street, and pickup trucks were forced down on their shocks. I gazed up to see an Army Black Hawk helicopter, giant in comparison to our standard medical helicopters, hovering steadily over the Children's Hospital helipad. Rain and fog swirling in all directions. Every part of the office thumped, the heartbeat in my own chest now overpowered. Events moved quickly after the girl's arrival. In the pediatric trauma bay, 2 of the soldiers who brought her through the storm, still in their wet flight gear, worked alongside our nurses. As I came to the bedside, one of the nurses greeted me by name, and the younger of the 2 soldiers, for some inexplicable reason, immediately snapped to attention. A vision of my father in his flight suit flashed in my head. "At ease, soldier," I said. "I should be saluting you." As we packaged the child up and headed off to the elevator up to the operating room, I turned back to them. There they stood amid the residual chaos of the trauma room, torn paper packaging and discarded blue gowns strewn about. They watched us roll into the elevator. I locked eyes with the closest soldier. He gave the briefest of nods just before the doors closed. Then he and the chaos of the trauma bay were gone. The OR team was ready for her. The sterile instruments laid out on the back tables, blue drapes applied after a quick clipping of her hair, and lightning fast wash of her head with sterilizing prep solution. In life-saving operations like this, as the clock has ticked past zero, the typical precision of neurosurgery loses out to speed. Speed at all costs. Knife, no, damn it, we can stop the skin bleeding later. Retractor, drill, scissors to open the dura, bulging and tight from the underlying blood. The liquid part of the clot jets out around the scissors as we cut. Once the brain is exposed, it does the work for us, extruding most of the solid coagulated clot out in a matter of seconds. We clean out what is left at the edges, and I see the offending vein torn away from the brain during the accident. We coagulate it and begin to make our way out, step by step, gently repairing all that we had to take apart to get there. After surgery, she immediately began to stabilize, waking up and even flickering her eyes open. But her recovery took time, and her journey was not without cost. She was left with a noticeable weakness on the left side and the slightest slur to her speech, but she was alive. With each follow-up appointment, some hurdle had been overcome. Over time, I would receive updates from her family. She would come to enter and then win a local beauty and talent pageant, be voted most school spirit, cheer alongside friends dressed up as the school mascot, and then one remarkable May Day, graduate from high school. 4 years later, she would finish college and head to graduate school for a career in social work. All of this chronicled first in clinic visits, then as the medical reasons to see me faded, in holiday cards and the occasional letter. A decade and a half after her injury, I received one such letter. No longer the hand-drawn cards of childhood or newspaper clippings from her proud parents. This was a handwritten note on elegant stationery inviting me to her wedding. Her wedding. I could still see her in the bed of the pediatric ICU after surgery, a 9-year-old child with abrasions on the side of her face from the accident and a clean white head wrap around her head. The nurses methodically connecting her to the monitors, line by line, tube by tube. Me urging her to squeeze my hand for a sign, any sign that she was better. Now, years later, I was reading how thankful she was to have been given this chance. Grateful for the soldiers in that helicopter, for the 2 hospital teams, and for me. She promised to always have us in mind as she began her new married life and hopefully one day raised her own family. As I read the letter sitting in a different office in a different city, thinking back over those events, I found myself realizing how deeply grateful I was for her evolving story over the years. All the cards, each barrier broken, every milestone, and for what that experience taught me. So many other critically ill children in the subsequent years benefited from this early experience when I was learning how hard to push, where to draw the line, and how much to expect of others. My father's lessons in the air, that industrious emergency room doctor, those brave soldiers soaked to the bone, standing there as we rolled away. So many people and events came together for this one child to grow into her life, to find happiness, to find love. All of us need a living, breathing reminder to just keep pushing on. There may be a life there to be beautifully and fully lived, a person who just needs someone, anyone, to work the problem, to make the hard call, and to fly in a storm. So clearly that story impacted my life. And for a long time when I decided to write the book, I wanted it to be about stories about children that had impacted my life. And then actually, I'll go back one. It was Jerome Groupman in this art essay in The New Yorker who reviewed the book and positively, and I was very grateful for that. But just like in every academic paper we write, there's a paragraph on complications. He said, the one thing I would say about Dr. Wellons is that he really didn't get into the public health issue, the overarching issue of the child with a gunshot wound to the head, the issue with guns. And that is something that matters to me. Now, I'm a son of the South. I grew up in a home where, we went hunting and target shooting and all those things. But certainly as a neurosurgeon, we see the business end of weapons and some of the difficult things that can happen. After Uvalde happened, you can see bottom here, I'm a member of the executive committee for the ASPN, the American Society of Pediatric Neurosurgeons. I'm honored enough to serve as president starting in a few months. But at the time, emails went out among everybody, like, what do we do after the shooting at Uvalde? Does anybody know a senator? Is there some advocacy? What can we do? And then Dave Limbrick at WashU had said, Jay, you should write a piece on it. And so I thought about it and I said, I really should. And what I did is I wrote about what it was like in the operating room. And I said, warning, this is graphic from the very first line, and described actually what it's like when we have a severe gunshot injury to the brain. And it's one that needs an operation. There's a blood clot there, there's bleeding there, underlying vascular injury, and just how deeply sad and profoundly emotional it is when the child ultimately dies and the family has to go through that realization that there'll be no more breakfast with their children anymore. And then I wrote about this concept of how we didn't know what to do. And then I wrote a little bit more about assault weapons and whether or not wherever anybody in the room is or on Zoom is on this political issue, I did have the opportunity to write into what I thought was important advocacy. And that was published in Time Magazine, and that was a moment for me that I was proud of. And then a few months ago, I found myself in the emergency room in Nashville, waiting and waiting and waiting for the shooting at the Covenant School, just like our colleagues in Uvalde were waiting and waiting and waiting. And in that article, I'd written about John Martin, a colleague of mine and Phil's, who is the chief of pediatric neurosurgery at Connecticut and up in Newtown. When those children were shot, he was waiting and waiting and waiting. And so that was picked up by a friend of mine who works for MSNBC, and I found myself on CNN, on Morning Joe, and some other shows, really having an opportunity to move into the advocacy world. And so I think when you think about reasons to write, one of the reasons that I'd felt it was important to write for many years was to tell stories of patients. But for me, I've slightly moved into a little bit of this advocacy piece too, because certainly stories, oftentimes you can take a ton of slides of data, but if you have a story to go at the beginning or the end, it can really make a larger impact. And speaking of impact, these are all the patients that we care for. I've had a wonderful practice and have been able to do lots of different aspects of pediatric neurosurgery over the years. But as we were talking about last night with Dr. Q, you have to, begin to give away parts of your practice in order to build a real division. I think the joke was made that you had given away scoliosis surgery, Dr. Q. Yeah, that was right. Humorously, but having, being able to bring good people in and form a division is about something that's larger than yourself. It's a shared mission of many people. And so I have enjoyed the work doing Chiari work over the years. I think some people think that maybe it's not the most glamorous of work because a lot of it's maybe not understanding who to operate on and who not to operate on and so forth. But working with Dave Limbrick at WashU, who's now going over to be the chair at VCU, we've been able to do some national studies and randomized controlled trials that really help us know who benefits from what surgery and who not. And so this has been probably the part of my practice that I've enjoyed the most. I think it's almost like sports medicine in that we take healthy kids and get them back to doing the things that they're good at. So with that, I'll say thank you. As I was saying before, it's just such a wonderful honor and opportunity for me to be here and for me to learn from you all. I certainly will say that if any of you have any books within you, I'm more than happy to talk about that process. And I could talk about this for hours and hours and hours on end until the residents are all asleep. But I won't do that to you. But thank you, Dr. Q, and thank you to the rest of the faculty. It is just just wonderful to be here. I'm very grateful. Thank you. Thank you for this.
We're gonna pass the microphone around. The first thing that I like to say is the following. You know, I got the book thanks to Dr. Mead right here, Paola, who had read it before I did, and said to me, boss, you got to read this book. And then I went to get it in July of last year, and I read it over the weekend. I mean, I just couldn't put it down. And I got to tell you that I found I could relate to it as a father, as a patient, as a brother, as a significant other, as a physician. I could find my voice, my feelings, and there were sort of a hurricane of emotions. Sometimes I was smiling and laughing in some of your stories, and sometimes I had tears in my eyes in hearing some of the stories, because not everything is triumphant, in everything that we do. But it is a beautiful book. I know that we have copies for the residents, for the fellows, for the faculty, that you're gonna allow us to get your signature on and your autograph. So we really thank you. We had a wonderful dinner last night here in Stories. I encourage everybody to get the book, please, and read it and find your voice. We were just talking with Selby last night. He's got ideas. All right. And I think that more we write about our emotions, we don't really talk too much. I'm looking at Dr. Freeman and all the amazing patients that he's had over the years in the neurocritical care as well. So everybody has to find their own voice, as you said to us last night. And I thank you, Jay. What you do is more than writing. What you do is you spark, stimulate our limbic system. You allow us to dream. You allow us to get emotional. You allow us to relate, to a field that is complex sometimes to understand, and I think that you did it beautiful, more than any other book, that I have read. And I read a lot of books, over the years. And for neurosurgeon, we talked about Dr. Marsh last night. We talk about Keith Black's book. We talk about Sanjay's book. I talk about my own book. I was like, man, my book is like nothing. I mean, I was teaching with my daughter about this. I said, I want to learn how to write, like Dr. Wellons. And I was inspired. I continue to be inspired. And we're looking forward to the next book.
Thank you.
So I open it up for questions now, and we can pass the microphone around. And online here, Selby.
Well, thank you very much for that excellent talk. I know we spoke at length last night at dinner. Neurosurgery is obviously a very specialized field. When you write either articles or books that are meant for the general public, you kind of have to walk that line between writing something that's stimulating to neurosurgeons and at the same time digestible by the general public. How do you find that balance? How do you go about that process?
Well, that's a great question. And I just did not want, the consent form is supposed to be for somebody with a grade level, 6th grade level, and I just didn't want to do that. I wanted to reflect our field in a way that walked that line. That was really important to me. I will say that's what a good editor does. There were some times that I would maybe go into a little bit too depth. I'll tell you a funny story. When I explained the dura, I called the dura the tough leathery membrane that covers the brain, right? And it was a friend of mine that had pre-read the book and said, Jay, because what you want people to say, like, you've already introduced this character here. You don't need to reintroduce them. So I don't need to reintroduce the concept of dura every time. Like, you say leather so much, you should only say leather that much if you're talking about like luggage or leather or bondage. Like, those are the only reasons to talk about leather that much, right? And so that's one. And then the chapter entitled "The Brain and All That Moves Us." I don't know if anybody's read Moby Dick by Herman Melville, but if you're reading along, you're getting the characters, and then all of a sudden you get to like the 4th or 5th chapter, and it's just about whales. It's just like, it cuts the narrative. Like, all of a sudden you're learning about sperm whales and all different kind of whales, and you're like, where is this chapter coming from? And then you read along a little bit more, and then there's a chapter about boats, and it talks about but I was like, well, if Melville could do it, I can pull this off. So I tried to do a chapter that was really a kind of lyrical description of neuroanatomy alone. And the Random House people started calling it my whale chapter, right? So that basically the concept was, you need to write through this with stories. And so I think stories helped to you know, to be able to explain the anatomy. But it was extraordinarily important. I want to just find something really quick, like gunshot wound to head. Like I did not want to pull any punches. You know, I wanted people to understand, you know, what this was like. So I'll just read this real quickly. I looked down to the mishmash below me. Hundreds of tiny blood vessels on the surface of the brain were disrupted and bleeding. The dura was ripped open all the way to the skull edge, nearly to the midline sagittal sinus. The sagittal sinus is a triangular-shaped flume that drains nearly all of the blood of the brain. When this is torn or disrupted in any way, particularly in a child, you have to handle it quickly, or depending on the age, the child exsanguinates, dies from blood loss. Fortunately for this one, it was intact, and I had no intention of wandering too close to change that. Blood oozed from the bone edges in spots. Bone wax is exactly what it sounds like, sterilized wax that can be pressed into the bone and stops the blood coming from the vascular cancellous bone that runs inside the inner and outer table of the jagged bone edge. The most rapid blood loss in front of us, however, came from the torn skin edges. The scalp has an intricate maze of blood vessels that keeps it nourished and healthy. This is why when you cut your head, it bleeds profusely. Scalp bleeding from a straight or smaller cut will usually stop with direct pressure, but here the severed ends of multiple scalp arteries that run just underneath the layer of protective fat in the scalp are pulsing away, adding to the growing pool of blood. And I just read that just to say, I really did want to not dumb down our field. I wanted people to understand that it's complex, but I wanted to use language that they would understand what it was like to do the operation, and not in any way to compare myself to Hemingway, because I'm not doing that at all. But what I liked about Hemingway, his concept was, if you want to write about something, you got to go live it, go do it. Hence his, you know, running with the bulls, or being a bullfighter, or going to Africa and big game hunting. And so this concept, like, who's better to write about neurosurgery than one of us who have lived it? So it is a balance. It is important to have good editors that tell you when you're getting too deep in it. But it was important to me from the beginning to write it in a way that didn't shy away from some of the challenges that we have.
I think that's David. Dr. Freeman, who's the director of Neurosurgery today.
So Jay, phenomenal talk about storytelling, and just some quotes came to mind. One was by Steve Jobs, who said the most powerful person in the room is the storyteller. And Eric Schmidt, the former CEO of Google, used to talk about Steve Jobs had this like force field around him, and how people just got sucked into this. You know, he was able to, you know, tell stories and transform an industry. The second one I think you'll like is by Ernest Hemingway. He said, "There's nothing at all to writing except for getting in front of a typewriter and letting your fingertips bleed." And so I think there's something ancient about storytelling, something about the fireplace, the social connectedness, and also, you know, catharsis. So thank you for reigniting our passion and sharing our stories.
Well, thank you for that. I appreciate that. And, you know, I have this concept when I talk about, you know, commonality being established, and then community. And then, like, I do have this concept that this idea in my head when the caveman or Neanderthal, you know, first had fire, whether it was a lightning bolt, and then they contained it, and they had a fire, and then they pulled some logs up, you know, and then they sat and warmed their hands, and it was this, well, what'd you do today? You know, well, what'd you do today? You know, like, over time, there really is this sense of commonality that can occur through storytelling. Yeah. Yes, sir.
Jay, terrific talk. I've known Jay since he was a fellow, and have watched his career with awe. And I think you residents are in for a treat today. You know, one comment and a question. So, you know, the comment is, you know, you've done a terrific foray into writing, and I suspect this will be your second career. But the comment is to the audience. I just want you not to lose sight that Jay's actually a good surgeon, and he's a good researcher, and he's not just a good author. What Jay's done in the academic and clinical fields are astounding. The question is for the audience, and you know, for for us mere mortals is you've accomplished so much in a short amount of time. And can you give us and the residents some insight on how how did this come about, and did you plan it, and how do you manage to balance your time?
Well, thank you for those kind comments. I appreciate that, Phil. And we have known each other for a long time through organized pediatric neurosurgery, and some of the research that Dr. Aldana has been leading in the Moya community, which we're all very grateful for. Those studies needed to be done, so thank you for that. I would say the most important things for me from a 20,000-foot view are to have people that you trust, that you work alongside. I loved my time at UAB. I mean, Phil knows I had great partners, and it was not easy for me to decide to move to Vanderbilt. The program was smaller at the time. It was most known for fetal neurosurgery, which has been a fascinating part of my career. But obviously there's a lot more to pediatric neurosurgery than just fetal neurosurgery. And so I'm very fortunate to have had the opportunity to bring people in to be a part of the program who I deeply, deeply trust, and whose mission I share too. So if Rob Naftel has a vision for how he wants epilepsy surgery to grow, or how he wants the rhizotomy program to grow in a multidisciplinary way, or Chris Bonfield's global neurosurgery, or his craniofacial program, or Michael Dewan, or Haley Vance's work that she does in concussion, it's really about putting people around you that share what your goals are. So I think that's the first thing. And then the second thing, which is equally as important, is, to me, it would be difficult to march into battle if I was not marching under a flag that I believed in. I'm very fortunate to have, to work for people that I believe in. My chairman, Reed Thompson, is a deeply good person. He's a very close friend, but he's a deeply good person. He really has a good heart. And it is very easy. It's easier for me to march into the hard times, the pandemic times, we don't have enough, the revenue for the hospital is not what it should be. So we have to, not do these things for a little while. It's a lot easier to handle all that if you have somebody that you believe in, that you work under. And so I think those are the most important things for me. In terms of time, it was important to me to do these things and not sacrifice family. I have an 18-year-old son who I love deeply, and I have a 14-year-old daughter who I love deeply, and I have my wife of nearly 30 years, who's an adult endocrinologist, and her career is important too. And I have a dog who is terrific, and a neighborhood that I love, and a church, and friends, and sports, and a yoga practice, and all the things that round out our lives that make us more than just neurosurgeons. And talk to this piece about wellness and resilience, but wellness not just for the point of resilience, right? You're doing those things not to keep you resilient so you can work hard in stressful times. You're doing those things because it makes you a better person. And so, to me, I think it was important to not sacrifice family time. So in terms of when do you find time to write, I think that is when you're on call on the weekends. You go in, you round, you do the case that needs to be done. And then, you tell your family, like, look, this is just, when my wife is on call for endocrinology, which is not as often as I'm on call for pediatric neurosurgery, she goes in and she stays all day, and then she comes home at the end of the day, like on the weekends. And so that's just what I would do when I was on call. And then I'd been on the Journal of Neurosurgery editorial board for pediatrics, and you learn how to have aliquots of time that you spend. And so I think between having people that you trust, between believing in who you work for and the mission, and then being able to find time during your work week which may not be as perfect as you want. I need a cabin in the woods with no internet access and stocked with Earl Grey tea. That's just not going to happen. You can take a sabbatical to do this. And I'm not denying it in case Reed Thompson's watching this. I will take a sabbatical if offered one. But I think that's the best answer to that question. So, yeah.
Fox is going to be talking about Wellons.
Oh, perfect. Yeah, great. I saw that you have a talk coming up. Yeah, it's great.
Yeah, thanks, Jay. That it's been great to have you. Really enjoyed dinner last night and learning more about you and your process and everything you've accomplished, like Phil just noted. And thanks for reading that chapter. I think anybody who heard that and didn't feel their emotions kick up a little bit, maybe should consider another career. Because that was incredible. This sort of ties into wellness and some things I'm talking about, at CNS, but really, when you hear that story and hear you talk, it's the opposite of a lot of what we see in medicine today with, cynicism and difficulties and sort of getting away from the core of why we do what we do, which is to try to help people and save lives. And you mentioned something last night that really I took to heart, and I was thinking about it. And you talked about how when you wrote the book, some of the nurses who you knew in the ICU for many years said to you, "Oh, wow, we read that. And now we really have an understanding of why you guys are the way you are and what you go through on a daily basis."
Yeah.
So what's your advice to the group here, our residents in particular, younger faculty and even older faculty, of even if we're not as good at storytelling as you are writing a book, but how do you increase that understanding, especially in today's day and age when so much is about numbers in medicine?
Yes, that's very true. One of the pieces in the book is about the fact that I had to take a child back with this very complex cavernous malformations, multiple chains of cavernous malformations, and I ended up having to take him back to the OR. And how in the back of my head was this, return to the OR rate. Somebody's going to tell me about this on the U.S. News at World Report, blah, 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 and how I just finally had to lay all that down, because that stuff that can affect you. And we are in medicine metricized from all directions, from how we wash our hands, which is important. I'm not discarding Lister, may you rest in peace. That is important, but we're metricized on how we do that, all the way to how quickly we do our notes on our EMR, to how we communicate with people around us, to how fast we get our consults done, to if we're at the OR on time, to whether or not we do enough lectures for the residents, to ... It's almost ad infinitum. And so sometimes you can feel like, you guys, if anybody ever played those games when you were at those Dungeons and Dragons games, like those dodecahedron dice, like you could feel like you're in the center of just a dodecahedron where you're supposed to be kept within, confidence intervals in every infinite direction around you. And on top of that, I want to just to give just a little bit of what you're talking about. The seriousness of what we do is important too. This piece is about a child who I should have operated on and I didn't. And I'll just say, it's going to take me 30 seconds. To this day, I have no idea if he would have returned with a re-rupture had I taken him to the OR that same day as the initial angiogram and clipped it. Even now, as I write this, the very idea that the same thing would have happened regardless of my action sounds like a feeble attempt to assuage my guilt. If I had performed the surgery and it had re-ruptured later, I'm certain that I would have written an essay similar to this one. Instead of remorse that I did not act, it would have been remorse because I did. People can die. Kids can die. You can do or not do. You can pray or not pray. You can work past the edge of exhaustion, but they still die. Death becomes a part of your daily rhythm. One may become inured to it, but I have yet to find a way to rid myself of it completely. I desperately want it gone, and yet for some odd reason, I desperately want it never to let go. Without it, there is no final line to hold. Without it to struggle against, we become less of who we think we are. So that's the seriousness of what we're caring for. So in the middle of this dodecahedron, we're also doing some of the things that are the most serious part of this human condition that we're a part of. And so I think, short of writing a book, I think communicating with your teams and your PICUs and your NICUs and your recovery room and your ER, and having people go give lectures on the cervical spine, or go give lectures on craniosynostosis, or go to the Cumberland Pediatric Foundation and talk about scoliosis, and maybe begin each one with a story, or have a story in there somewhere about the person behind what it is that we do. To me, I think that's the best way to do it. I mean, I didn't know the Steve, Jobs quote, but that's a really good one. The storyteller is, my friend John Meacham, who I was in high school with, who's a historian, he says, they say that history belongs to the winner, but actually history belongs to the storyteller. And so I think that's true to some extent too. Yeah.
In Mexico, we have a phrase that is called parteaguas. That means that something happens in your life that is very important. For me, your book came at a very critical point in my life where I was really struggling, emotionally, and I began to see a therapist because of exactly what you just said, the inability that we have in our professions to allow ourselves to be imperfect when all we expect is perfection of what we do, and all the world expects from each of us is perfection. And very few people understand what it's like to walk every single day into the operating room, and everybody in this room is doing it, and walk that fine line between life and death. And many times we don't walk it back, but we cross to the other side and we just feel guilty, remorse, emotionally struggling. And I was going through all the struggles, and your book allowed me to give myself permission not to be perfect, not to attempt to be perfect, and to recognize that there are things in life that we just simply sometimes we cannot control. And as arrogant as we try to be, thinking that we can control all the variables, many times we just simply can't. So thank you, Jay. It's a beautiful
Thank you for
book.
saying that.
I thank you immensely from the bottom of my heart. We have books to sign. I know they're here. Are we going to set a table with? Yeah, there you go. So they're getting ready. Thanks everybody from around the world. Many countries around the world join us today. Thanks everybody for joining. You can see everybody's day. There's a lot of stuff going on and a lot of people online, and we're going to have a great day. A lot of people are going to meet with Dr. Wellons today and the residents and us, and then we're going to spend the afternoon before we get him out there back home. He came straight from a book signing, 110-degree temperature, signing thousands of books, and came straight to join us for dinner last night. So thank you from the bottom of our heart, and we're looking forward to many, many more events together.
Absolutely.
Thanks, everybody.
Thank you so much. Thank you.
Thank you. Thank you. Nice.